Senate Bill 897. Imagine this. Imagine a nonprofit in a big city trying to open a mental health clinic for veterans. They qualify for state help, but before they get a single dollar, they have to raise almost the same amount on their own. They spend more time fundraising than helping veterans, and some clinics never open at all. What the bill says it does? Senate Bill 897 says it is helping veterans by making it easier for community mental health programs to qualify for state grants. What it actually does? This means large counties no longer have to match state grant money dollar for dollar. They now need to cover 75% instead of 100. Smaller counties keep their lower match rates. But the change only applies if lawmakers put money in the budget. If they do not, the agency can choose not to implement it at all. Who benefits? Veterans and families in large urban counties who may see more mental health programs. Counties and local mental health authorities that can stretch their budgets further. Large nonprofits with strong fundraising and donor networks. Who pays the price? Smaller community-based providers that still cannot raise a 75% match. Veterans if the legislature does not fund the change and programs never expand. Urban communities where need is high but access still depends on private money. Why it matters. Mental health care for veterans should not depend on how good a nonprofit is at fundraising. When access to care is tied to private donations and budget politics, help becomes uneven. Some veterans get services quickly, others wait or go without. That is not a stable system, and it puts the burden on communities instead of the state following through on its promises. Questions to ask its lawmakers. If this change depends on future funding, how will veterans know they can rely on these services year to year? Why keep a high match requirement in the counties with the largest veteran populations? And would you support regular public reporting to show which counties actually received new services under this bill? Bottom line, Senate Bill 897 lowers the barrier on paper, but leaves veterans' mental health care tied to fundraising and future budget decisions instead of guaranteed access.